Hi everyone, I am Dr. Sagar Sahu and welcome to Vet Surgery Writings. So today I welcome you to the last lecture of the radiology. So today we will be discussing the radiography pathology of the lung. Before this, I have delivered 15 lectures in this series, radiology. I will give the link to the playlist in the description, and also if you will check the description of each lecture video, you will find the link to the notes and also the PPTs that I am using and the book link. Okay, in each lecture video, there in the description I have given the link to the notes and the PPT and the book. Okay, so you can check them. Let us go to our class, that is the radiography pathology of lung, canine and feline. So I will cover some basic anatomy. Okay, regarding the long lobe, which long lobe is visible in which lateral or DV or VD radiograph, I have covered in the radiographic interpretation of thorax. Okay, normal thorax. Do check that out before watching this video. I will not be covering those sections, particularly those normal anatomic sections, because otherwise the video will be very long. That's why do check them out before watching this one. I will just cover some basic anatomy. Okay, so the anatomy of the lung, which is important from this class point of view, that is, it is basically analogous to a sponge. Okay, in kitchen or any other things you do, if you are using sponge, so it can be related to sponge. It has some numerous air spaces which is known as alveoli, analogous to alveoli, and also the network of fibers. Okay, which can be analogous to interstitial connective tissues. Okay, and also due to this particular thing, the air has, the alveoli has air, so it has air opacity, while the interstitium, it is a soft tissue but it is very thin. You can correlate with fat opacity. Okay, correlate with fat opacity, but it's a soft tissue. Okay, it is not exactly fat opacity. Why I am telling fat opacity? It is only from understanding point of view, so that you can understand the lung patterns better. Okay, but it is not exactly fat tissue. Don't tell anyone that interstitium has fat opacity. It is a soft tissue. It has some soft tissue opacity, but you know, shades of gray are very relative. Okay, so so that you can understand actually the lung pattern, I am telling this fat opacity. Due to this, it has air opacity and it is a fat opacity, so mixture will have a heterogeneous network opacity. Also, the heterogeneous opacity is contributed by atelectasis, especially on lateral radiographs. Okay, do check the normal thoracic radio. I will provide the link in the description. There I have explained in better way why lungs has a slightly higher opacity when it only contains the air. Okay, because of atelectasis. Now this is a normal radiograph of thorax. This one is the right lateral view. You can see the diaphragm is parallel to each other kind of. Okay, right lateral view. You can see the lungs. Okay, you can see that there is some network structure like here and here everywhere. These are basically the interstitium. Interstitium contains blood vessels, nerve fibers, etc., etc., etc. But only the blood vessels will be visible. You can see that here two vessels. Can you name these two vessels? I have discussed in the cardiovascular system, radiography pathology of cardiovascular system. This is basically the cranial lobar vessels. This one is the artery, this one is the vein. The cranial one is the artery, the caudal one is the vein. Between that, it's bronchus. Okay, so this is vessels. These are some pulmonary vessels. Here you can see the descending aorta. Okay, these are basically vessels. This is caudal vena cava. Okay, so all these vessels are present along with some networks. You can see there mostly the blood vessel networks. Okay, so these networks are normal. These heterogeneous opacity are normal. Sometimes they are misdiagnosed as some pattern or like that, but it is not pathology, it is normal. This is also VD and DV view. We can see that it is not exactly completely black, which is air opacity. There has some heterogeneous opacity. It is kind of heterogeneous. Okay, it is not exactly black. You can find some networks which are basically the blood vessels. Here you can see, here you can identify two major blood vessels. Here is one vessel, where is one vessel. Can you name these vessels? These are caudal pulmonary vessels. The lateral one is the artery, the medial one is the vein, between them is the bronchus. Can you see here a circular opacity? This is basically a bronchus. When the X-ray beam hits on end on, I will discuss what is end on and what is side on hitting of X-ray beam. So when it is hit end on, you will find a black circular structure. Okay, this is basically the bronchus. But if you are finding multiple, then it might be some pathology. Otherwise, in normal cases, you may find one or two accidental. Okay, so this is normal, this is not pathology. If you are finding this and others something, I will discuss. It is alveolar pattern actually. Okay, we'll discuss alveolar pattern, but this one is normal. This opacity is normal. These are some network heterogeneous opacity because of interstitial tissue. Here, this is a zoom in view. We can see that this is a dorsocaudal location. Zoom in view, we can see some networks here and there. It is not exactly black. Air provides a background actually over which this interstitium is visible as networks. Okay, this is a radiography view of right caudal thorax. This one is the right side caudal thorax. So you can see some networks. Usually they are blood vessels. You can see the small vessels like things. These are blood vessels. Okay, interstitium contains blood vessels. Okay, so you may not need to misdiagnose these things. Okay, you have to see also the radiographic signs and also the clinical signs, the signalement, all those things we have to correlate, especially while evaluating the lungs. Okay, it can be very tricky due to heterogeneous opacity. Okay, next we will go to our these patterns. There are basically three patterns. That is, the first one is the alveolar pattern, next one is the bronchial pattern, third one is the interstitial pattern. Okay, we will discuss one by one. First one is the alveolar pattern. So the alveolar pattern means here the portion or the chamber, or you can say the part of the lung which is affected is alveolus. So what happens this particular thing, or how the alveolar pattern is developed? When the alveolus is filled with fluid, you see alveolus contains air. Okay, it contains air. When it will be filled with fluids, or sometimes it is less likely, it may be filled with cells, then this particular pattern will develop, or the radiography opacity will change as fluid is of fluid opacity, or you can say soft tissue opacity. The opacity of the alveolus, which is air, will change to soft tissue opacity. The common causes are the pneumonia. I have told about the cardiogenic pulmonary edema in the previous class, that is the cardiovascular system. Traumatic hemorrhage also can produce this type of lesion. Only differential diagnosis is atelectasis. In atelectasis also you will find increase in opacity or soft tissue opacity of particular lung lobe or particular lung side. So the differential diagnosis, in case of atelectasis you will find mediastinal shift. Can you tell what is the reliable sign of mediastinal shift? I have discussed in mediastinal shift. It is the heart. When heart is pushed to some side, then it is a reliable indicator that mediastinum has been shifted. So what are the radiography features? Three features. One is AR bronchogram. We will discuss one by one. Then the lobar sign, and when these two are absent, then you may find an area of relative high intensity opacity. The opacity intensity will be high. Usually it will be of soft tissue opacity. The only differentiating thing is particular this sign. If you are not finding this one, is the differential diagnosis is unstructured interstitial pattern. Okay, interstitial pattern can be of two types, that is the structured and unstructured. We will discuss. So the differentiating is unstructured interstitial pattern. What happens actually in particular this pattern? You will find that in this particular pattern the intensity of opacity will be less. It means actually, what is intensity opacity? If the opacity area is this much, you will divide into some per unit area. The relative intensity will be more in case of alveolar pattern, while it will be less in unstructured interstitial pattern. We will see the radiographs also, then you can see, but for your clarity I am telling that, so that I don't have to explain there. So this is the differentiating between unstructured interstitial pattern. Also it can be differentiated with structured interstitial pattern. Structured interstitial pattern is basically nodule or mass. Okay, so in nodule and mass you will find a margin, while this particular thing you won't find a sharp margin. We will see the radiographs also. Now let us go to how this develops, how this particularly the AR bronchogram, how it develops. So here it is a normal radiograph, this one is a normal radiograph, while this one is the AR bronchogram radiograph or abnormal AR bronchogram. So how this develops? Now in the normal one, notice these things. Here this black portion is basically the alveoli. This alveoli is of air opacity. This white is string like thing is basically the interstitium, which is of fat opacity. For your understanding, I am telling fat opacity because it is slightly less than the soft tissue opacity. Now this is a vessel. I told you in interstitium you will find vessels. Vessels are of soft tissue opacity. And this black thing is bronchus. Bronchus contains air, so it is air opacity. This alveoli will provide a background. This is air background. So normally the bronchus is also having air opacity. The bronchus will not be visible. Normally it will not be visible, while these vessels will be visible and the interstitium will be visible, which is have some heterogeneous opacity. So when this particularly alveoli will be filled up with this particular background, or you can say alveoli will be filled with fluid, like in this particular case, it becomes soft tissue opacity. This interstitium is fat opacity, but it will not be any more visible because soft tissue opacity will hinder, or you can say mask this one. The vessel which is soft tissue opacity will also not be visible. It is soft tissue opacity, it will not be visible. But the bronchus is normal. Here in alveolar pattern, the alveolus is affected, the bronchus is normal. So this bronchus will contain air opacity, and it will have air opacity. So this particular air opacity will be visible under a soft tissue background. Okay, so this soft tissue opacity will give, or you can say it will make the bronchus visible, which contains air. This is air opacity, so it is known as air bronchogram. We will see the radiographs. Okay, air bronchogram. Now this air bronchogram can be visible in two ways depending on how the X-ray beam hits this particular bronchus. So this is a bronchus and this one is the alveolus, which is abnormal. It will appear soft tissue opacity, that is white, kind of white soft tissue opacity, and this is air opacity. Okay, so what happens if this particular bronchus is hit side on? It does not mean this is horizontal beam radiography. For your understanding, I am telling, if it is hit, the primary beam hits this particular bronchus side on, then you will find like this bronchogram, like this. If the X-ray beam will hit, because it's a 3D structure, right? If it is hits end on, this is end on hitting, you will find a circular patch or some slightly kind of circular or some like this shape, irregular shape. Mostly it will be circular. So you will find like this, depending on how the primary X-ray beam hits the bronchus. Let us see some radiographs that you can see. Now this is a dorsoventral view. Can you see a bronchus actually? Here can you see a bronchus here? Okay, it's a bronchus here. One thing arising, another thing arising. Here is a bronchus. This is air bronchogram. Okay, this is the characteristic sign of alveolar pattern. Okay, air broncho. Let me erase this one for you so that you can see. Can you see this now? You can see here. Okay, this is air bronchogram. This is air bronchogram. Okay. The background is soft tissue and this bronchus, normal bronchus containing air will be visible. Okay, this is alveolar pattern. Let us see another radiograph. This is another radiograph. Very nicely now you can see. Can you see? This is the bronchus and here is the branching of bronchus. Okay, like this it is coming, here like this coming, branching. Okay, here is branching, here is a branching. Okay, this is the bronchial tree. You can say the bronchial tree. So this is the air bronchogram. the background is of soft tissue opacity because the alveoli is filled up with fluid, okay, more or less likely cells. So now this background will provide the contrast for normal bronchos to be seen, which is known as air bronchogram. Another sign is lobar sign. Okay, lobar sign. What is lobar sign? It means sometimes what happens, a particular long lobe will having some problem, pneumonia or edema, whatever it, and the nearby long lobe will be normal. So when the X-ray beam will hit parallelly, it will hit parallel to this particular two different sets of long lobe, having one having infection, one having no infection or normal one, then you will find a separation line. Okay, just like the intralobar fissure in case of pleural effusion. Okay, in case of pleural effusion there is other signs, here it is something different. So this particular lobar sign will only be visible when the X-ray beam will be hitting parallelly. If at all it is hitting in some other direction, this particular lobar sign will not be visible. Okay, but bronchogram is visible many times. So here it is a radiograph. Can you see a lobar sign here? This one is the normal lung, usually the middle lung lobe. Can you see this lobar sign? And can you see the bronchogram? Here is the bronchi. You can see here like this it is going. Okay, this is air bronchogram along with the lobar sign. This is characteristics of alveolar pattern. Let us see another radiograph. There is much more radiographs, you don't need to worry. So here can you see this this circular thing, this is basically the bronchos hit primary X-ray beam is hitting end on, that is why this particular thing. Despite that you can see some bronchograms here and there also. Here small one, okay, here some, these are bronchograms, small bronchogram. The particular important thing is the lobar sign. Here can you see the lobar sign? Okay, lobar sign. In case of pleural effusion, you will find long retraction along with the lobar sign. Here it is not, there is no long retraction. And also you can see the opacity of this particular long lobe. You have the middle long lobe. This one is the right hand side. It is middle long lobe which has been infected or which has been infected with the pneumonia or pulmonary edema. Pulmonary edema usually happens dorsocaudal lobes. Okay, so this one is the middle long lobe, most probably pneumonia. Next, here see another radiograph. Can you see the lobar sign? Here is the lobar sign. This particular is the lobar sign, and along that you can find the increase in opacity. Okay, this is completely opaque. Though bronchograms are not that visible, kind of not that visible, but can you see here some bronchograms? This particular region. Can you see a bronchogram? Okay, this is bronchogram. This particular thing has this bronchos is actually visible because of soft tissue opacity provided by heart. You can see this particular bronchos. Okay, it is visible here. Is one branching here. Okay, so this is basically the lobar sign along with the air bronchogram. Next, over here another. Can you see the lobar sign? Here is the lobar sign. Okay, and can you see the bronchos? Here is the bronchos is running. Here is one branch here like this. Here is one branch. Here is one branch. Okay, this is bronchial tree, alveolar pattern having air bronchogram as well as the lobar sign. Okay, alveolar pattern. This is another radiographic structure, radiography image. Can you see here? This is lobar sign. Lobar sign. Okay. The bronchogram is not that visible, but the lobar sign is much more prominent. Okay, this is lobar sign. Next, the increased lung opacity. If you are not finding the air bronchogram or the lobar sign, then also you can decide whether this one is a alveolar pattern or unstructured pattern. We will see the unstructured pattern also, interstitial pattern. So the increased lung opacity can also be a sign of a alveolar pattern. So what happens in this particular too intense per unit area? I have explained this one. So differential diagnosis will be the long nodular mass which has a sharp margin. I have discussed. Unstructured pattern, it is less intense per unit area. We'll see radiograph, then you can identify. Okay. So here is a radiograph. You can see the dorsocaudal lobe You see here dorsocodal region of the lungs not lobe, dorsocodal region of the lungs is opacified. The opacity is nearly similar to that of soft tissue. Okay, nearly similar to that of soft tissue. If you will divide this particular region into different unit areas and you will measure the opacity, okay, it will be more than the unstructured one. We'll see the unstructured one. Okay, so this is the alveolar pattern. Here there is no air bronchogram as well as there is no lobar sign, but still this is alveolar pattern. This is another radiograph where the left caudal long lobe has been affected. Can you see the thoracic outline of diaphragm which is lost, which is so the opacity of this particular diaphragm is same as that of this opacity. Here is the opacity and the opacity has been extended to this region. It is not visible because of masking by the diaphragm, but this particular region is visible. The opacity is nearly same as of that of heart and the diaphragm, which is of soft tissue opacity. So slightly more opacity, it means it might have been the alveolar pattern, not the unstructured pattern. This is also another radiograph. You can see this particular thing, opacity of this particular lobe. Usually the caudal right lobe, this one is right hand side, this is caudal lobe. So this particular lobe has been affected and you can see the opacity of this particular region is same as that of the diaphragm here. Okay, it is same as that of this diaphragm. So nearly they are same. They will have a soft tissue opacity and they have slightly intense. Okay, when you see the unstructured, then you can slightly relate. Next is the bronchial pattern, the second one. So when I told you that in alveolar pattern the alveolus is affected. What if the alveolus is normal but the bronchus is affected? Okay, so in that particular situation you will find bronchial pattern. So what happens? The cellular fluid infiltration in the bronchial wall, or even sometimes the bronchial wall may not be affected, but the peribronchial area have some problem. So in that particular case also you will find the bronchial pattern. So radiographic features you will find ring shadow and tram line. We'll see. The cause is most common cause is allergic airway disease. You know this one, okay, from the medicine. So how this develops the tram line and the ring shadow? So here the lung is normal, this lung is normal, okay, but the bronchus is abnormal or the bronchial wall is abnormal. What will happen? This bronchial wall will get thickened. The bronchus contains air. Here is air and outside is air. So what happens? The air will be of black color, air opacity. So it is air opacity, here is air opacity, here is air opacity. But this bronchial wall, due to thickening, it becomes soft tissue opacity. So you will find a line. This is tram line, like railway track, tram line. And when they are hit side on, if they will be heated by the X-ray beam in end on, you will find a ring-like structure, which is ring shadow. Sometimes they are also called donuts. Okay, ring shadow or donuts, and you will find tram line. Okay, these two are the features of bronchial pattern. Let us see some radiographs. Here are some radiographs. This one is slightly not clear, but you can see the tram line here. You can see this tram line, two lines. Okay, I have some other radiographs also. This one is slightly not clear, not of that great quality. You can see one tram line. So here another structure, another radiograph. Can you see the ring shadows? Here is one ring shadow, here is another ring shadow, here is another ring shadow. These are ring shadows. Particularly notice that the middle one is containing air, but look at the walls, it is thickened. Okay, so this particular ring shadow, the walls is thickened. Okay, this is a ring shadow. Can you see a tram line here? Here you can see a tram line here. From this main tram line, some side tram lines are originating here. Okay, so this is tram line and donuts. It's a characteristic feature for bronchial pattern, mostly common in allergic airway disease. Here is another radiograph. Okay, this one is, can you see some, here you can see a donut. Okay, and you can see a tram line here also, tram line. Here is a tram line. The rib is having some intersection. Okay, you can see this. Normally also you will find some ring shadows. Okay, but notice the walls. Here the wall is kind of thickened. Okay, let us see another radiograph. We have such good quality of radiographs so that you can understand. Here can you see a ring shadow? Here is a ring shadow, here is a ring shadow, here is a ring shadow. Okay. Tram lines, can you see here a tram line? Very nicely seen. This particular bronchosphincter bronchial wall is thickened, bronchial tree is visible, but it is not the alveolar pattern. In alveolar pattern, you will find a soft tissue opacity and you will find air filled cavity, air filled bronchus. Okay, but here the heart is actually providing contrast, but you can see the tram lines. Okay, you can see these tram lines. Okay, this is the main tram line from which there are different tram lines are originating. Okay, this is tram lines. It contains middle air, side is air, and you have a soft tissue opacity of walls. Okay, so this is basically the bronchial pattern. The bronchial pattern. Let us see another radiograph. This is another radiograph. Can you distinguish the donuts? Can you see the donuts? You can see here it's a donut, donut, it is a donut. Okay, can you see some tram lines? Here is one tram line, slightly visible, but it is not that prominent. The donuts are visible. Here is another donut, 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 and donut, or ring shadows. Okay. Next is interstitial pattern. So interstitial pattern is of two types, that is the structured interstitial pattern and unstructured interstitial pattern. First one is the structured. In case of structured interstitial pattern, it usually refers to a pulmonary nodule or a pulmonary mass. The most common cause is metastasis. The characteristics of metastasis, you will find multiple nodules, while in case of primary tumor of lungs, you will find a single nodule. The critical diameter, it means the nodule has to reach some diameter to be radiographically visible. Or in case of dogs, according to some research, it is 7 to 9 mm. You have to reach that particular size to be radiographically visible. What is the difference between the mass or nodule? According to research, the diameter below 2 cm can be referred as pulmonary nodule, more than 2 cm can be referred as a pulmonary mass. Pulmonary nodule are often visible in only one view because of smaller size. Okay, so you have to take multiple views. Usually 4 views is recommended if you are finding some pulmonary nodule. Now the differential diagnosis is end on vessel. Sometimes the vessel, when you will be beam will be striking end on, it may find a soft tissue opacity, which you may confused with a nodule. But your differential is, you will find a tail attached to it, basically, which is the elongation of vessel. Okay, this is tail. We will see some radiographs, don't worry. Okay, this is only the differential diagnosis regarding the mass, pulmonary mass. Let us see some radiograph. Here is a radiograph. Can you see a mass, pulmonary mass here? So just here, can you see? This one is the nodule. Another radiograph here. See this one. Here you can see a differential diagnosis. Here is a nodule. Okay, can you see a nodule here? Here is a nodule. It's a nodule. But can you see two more nodule-like structure here and here? This is actually not nodule. These are basically the pulmonary vessels. Can you see two vessels here? I told you about that the cranial pulmonary vessels in cardiovascular system, also in normal radiographic interpretation of thorax. You see the anterior one or the cranial one is the artery, then the caudal one is the vein, and in between is the bronchus. But in this particular radiograph, you can see the three structure. I told you, when you will find a nodule with a tail, you can see this, there is a tail. It is basically the elongation of the vessel. So it is not a pathological nodule, it's simply the end on striking, the X-ray beam has struck the vessel's end on. Okay, so this particular tail, can you differentiate diagnosis between a nodule and the vessel, end on vessel. Now I told you in between is the bronchus. You can see that here is a nodule, here is the bronchus. Okay, the arrangement, usually it will be artery, then the bronchus, then the vein, AVV. Okay, here if you see the bronchus, it is a very thin wall, which is basically normal. It's very thin wall. Okay, which is normal thing. It's not a ring shadow. Let's see here you can see multiple pulmonary nodules. They are smaller size. It will be nearly less than 2 cm. So it is very small. Okay. Another radiograph. Here you can see pulmonary mass. This is a pulmonary mass. This is a pulmonary mass. Around this pulmonary mass everything is normal because this is the heterogeneous opacity of the lungs normally found. Okay, can you identify these two structures? Here you can see that this is caudal vena cava, here is the pulmonary vessel. Okay, here another structure of pulmonary mass, though it is not visible here because the pixel quality is not that good. You can see here a mass which is confirmed in DV view. You can see this one is the mass, pulmonary mass. Okay, next, the unstructured interstitial pattern. Unstructured interstitial pattern, this one is the most misdiagnosed pattern. Okay, so what actually happens, suppose this is lungs, this entire structure is lungs. What happens, sometimes the interstitium will be affected. Interstitium, the entire lungs is filled with interstitium. So what happens actually, suppose there are 3 levels. Okay, suppose this particular level like this, the interstitium has been affected. In this particular section like this, the interstitium has been affected, and in particular this section like this, this, the interstitium has been affected. What happens when you will take a X-ray, all these structure will get summed up in the X-ray. Okay, when they will be summed up, they will interpreted as different thing. This help is not present here actually, it is in different levels. When they get summed up, they produce something different. Okay, so due to this is the most misdiagnosed pattern. Okay, but if you will take care, then you can definitely diagnose this one. Okay, so the radiographically what you will find, the abnormal increase in the background of radiographic opacity, but this particular opacity is less than that of the alveolar pattern. Okay, and the summation effect, I just explained what is summation effect. So the signs that are visual radiography may not necessarily be exactly present in the lung, it might be some different. Now let us see some radiographs. See here, the opacity has been increased, slightly increased, this particular lobe slightly increased, but this opacity is not of soft tissue opacity. Here is diaphragm, here is heart, it is not that near to this particular soft tissue opacity, so it is slightly less. So you can say that this is unstructured pattern, unstructured interstitial pattern. Let us see another radiograph. See here, you can see this particular lung lobe is opacified, but if you will divide this to per unit area, can you see this particular opacity? See, there you saw that one. You can see that it is less intense, kind of less intense. So this one is the unstructured interstitial pattern. This is not alveolar pattern. Okay, this is not alveolar pattern. To see another radiograph, see this one, this particular radiograph, you saw this one is also. If we will divide this into particular unit areas, we will find that the opacity is not that strong or that intense like alveolar pattern. Okay, where that is complete soft tissue opacity. There are soft tissue opacities, but it is not that intense. Okay, so it is unstructured. You see in that book particularly, while reading, it was found that to identify the lung lesions especially these patterns, you need to train your eye. Okay, like you have to see thousands of radiographs, then only you can identify especially this unstructured pattern. Okay, so you have to look radiographs. You cannot be a pro just watching this video, definitely. So but it will give you a hint so that you can see multiple radiographs and you can become a specialist. Okay, sorry, let us see this one, the unstructured. Next one thing, the paradigm, airway versus non-airway paradigm. What actually happens if you are finding particular pattern in any particular lobe? Suppose you are finding the alveolar pattern in the right middle lung lobe. Okay, does not mean that the disease is limited to particular that lung lobe. It might be in other lung lobes, but that particular lung lobe is so intense that it is visible radiographically. So this is the difference. If you are finding in particular lung lobe or anatomical compartment, it does not mean that that particular only compartment is affected, others are not. Others may be affected, but they are not radiographically visible. Another thing I told you, you saw that long patterns individually, but sometimes they can coexist. We'll see the radiographs. So when they coexist, you have to be very careful. You have to look for the how the disease started, what are the clinical signs, what are the lab reports, and the diagnostics you have did. So you have to correlate, then you have to diagnose a disease or go for the treatment protocol. Okay. Or last thing, what you can do, if you are not finding anything, you can go for long sampling. Let us see some mixed radiography patterns. This is a mixed radiography pattern. It is actually, if you will look at this, you can say this is unstructured one, unstructured pattern. But you can find here, superimposed with the rib, you can find a AR bronchogram, slightly smaller one AR bronchogram. Apart from that, you can see here a ring shadow here. Okay, and you can see here a ring shadow. These are ring shadows which is of bronchial pattern. So this is mixed pattern. Okay, so you cannot tell that it is of some particular disease. I told you the alveolar pattern you will find in pneumonia, in the pulmonary edema. The bronchial pattern you will find in allergic disease. So what you will diagnose? Everything. So it is not me. So you have to look for the clinical signs. Let us see some other radiographs. Here, this one is slightly more intense. You can see that this is slightly more intense. It is related to kind of alveolar thing, not that of unstructured one. But can you see some? Let me show you here. This one is the tram line. This is basically the bronchial pattern. This one is the bronchial pattern, and you are also finding these intense areas which are basically the alveolar pattern. So this one is the mixed pattern. So you have to diagnose based on the clinical signs, other things you have to treat. Another thing, let me highlight for you. Can you see here? This is a bronchus. This one is a bronchus, but it is not AR bronchogram, because can you see here is a vessel actually. There is one vessel, is another vessel. These are caudal pulmonary vessels. Between those pulmonary vessels, you will find bronchus, which is basically normal. Okay. The differential diagnosis between this, okay, especially the tram lines. In case of tram lines, this is a differential diagnosis. So what happens actually? I told you the cranial pulmonary vessels, between them also there is bronchus. It is sometimes misdiagnosed as the tram line, but the vessel wall is very much well defined. So that well definedness is very differential to the tram lines. Okay, they are very well defined vessels. Here, although due to zoomed in, it is not that much visible, but if we took back to the normal picture, it may be visible. Okay. Next, here, this one you can clearly say this is unstructured pattern. This one is the unstructured pattern. But can you see a AR bronchogram here? This one is AR bronchogram. Okay. So this is AR bronchogram, and if you look, here is a tram line. Is a tram line. This is an unstructured one, not that opacity, intense. Opacity is not that intense. So this is mixed. So you have to look for other signs, symptoms, lab reports like that. This is another one. This is also unstructured. Can you see? Kind of unstructured, but you can see a bronchogram here. This one is a tram line. Okay. This one is a tram line. There are other tram lines also. This here is slightly visible. Okay, so this one is the mixed one. Here is another tram line. Okay, so this one is the mixed one. So when they are mixed, go for other signs and symptoms, or lastly you can go for the long sampling. There are coming to diseases, actually there is much disease. I have discussed the pulmonary edema, which you will find alveolar pattern, then the pneumonia, also alveolar pattern, then also you will find the you will also see the allergic airway disease, where you will find the bronchial pattern. Okay, like that. So in the diseases, there are very few diseases which you need to focus. This bronchiectasis is basically the abnormal dilation of the, or permanent dilation. This is permanent, which is also abnormal, permanent dilation of the bronchus. Permanent dilation of the bronchus. Okay, this happens chronic cases of allergic airway disease. You can see here the bronchus. Can you see the bronchus highly dilated, a ring shadow here. Okay, here you can see this bronchus dilated, bronchus. Okay, these are tram lines, ring shadow, ring shadow. Here is a ring shadow, a very big ring shadow. Here is a ring shadow. You can see these tram lines, tram lines. Here is a ring shadow. Okay, this is basically dilation of the, you can clearly see that the bronchial wall is dilated. Okay, bronchiectasis. Next, here is another radiograph. You can also see, can you see the donuts and the tram lines? See here, tram lines. Okay, here is, it has been divided. This is tram line, here is a tram line. Okay, it is here divided actually. Here is a tram line, donut, here is donut, here is donut, very big donuts, here donut, here is donut, here donut, donut, and here is a tram line. Sorry, here tram line, here tram line. So these are tram lines and donuts. Okay, bronchiectasis. You can see the clear cut dilation of the bronchus. Another radiograph here. This is inspiration versus expiration. This one is in the inspiration. You can see the wall thickness. You see here these pulmonary vessels. This is cranial pulmonary artery, cranial pulmonary vein. You can misdiagnose this one as a tram line, but the vessel wall is clearly defined. Okay, and this particular position I told you vessels are present, so you should not misdiagnose this one as the tram line. Similarly, for the caudal lobar in dorsoventral view, here is in expiration. You can see this wall thickness. Okay, it is still dilated. Next is which you can go for the long bulle. Long bulle is basically a structured interstitial pattern. Structured interstitial pattern. It means it's a mass, but mass with a cavity. Mass with a cavity is known as long bulle. Okay, it can be chronic, the chronic long bulle, or recent traumatic. Okay, so the difference it, in case of chronic long bulle, you will find a thin and regular margin, while in case of traumatic you will find a thick and irregular margin, Okay, this is only a difference. Here you can see in the chorodorsal portion of the lung you will find a long bulle, very thin wall but regular. Here is, you can find a cranial long lobe. You can see here, this is a long bulle, cavitary. You can see cavities, but the wall is kind of irregular, cavitary. Okay, this is basically long bulle. This is very rare finding in case of animals. Here another thing actually I wanted to tell you, although also the book it is mentioned, in case of cardiogenic pulmonary edema, it is very characteristic. You will find alveolar pattern, especially the caudal long lobes. Here you can see that. Can you see the bronchogram, alveolar pattern? Here is the bronchus which has been divided like this. Okay, bronchial pattern. Here in the other side also you can see the bronchial pattern. Okay, here like this, the bronchial pattern. Okay, also the opacity is slightly increased, especially this one. The diaphragm has been superimposed. Okay, but you can see this intensity is increased. Here it is a microchip. Okay, it's a microchip. So this is basically normal finding. Many times in many animals, many breeds, you will find this particular alveolar pattern in case of the pulmonary edema, which is cardiogenic. But in some cats and large breed of dogs, you will find the bronchial pattern, especially when the pulmonary edema is due to cardiomyopathy. In case of cat, it can be of hypertrophic cardiomyopathy. In case of large breed dogs, it can be dilated cardiomyopathy. So in these particular cases, you may find bronchial pattern of a lung pathology. Okay, let us see here. This is a radiograph. Okay, this is the caudal one. You can see the intensity is more increased. Okay, can you see some tram lines? Sorry, can you see some tram lines? Here is a tram line. Okay, and here is a tram line. The pixel size is not that good, that's why I'm not able to, it is not maybe clearly visible, but you can see some faint shadows, and you can also see a bulle here. Sorry, not bulle, the ring shadow, sorry, the ring shadow. Here is a tram line, ring shadow here, and here is very clearly visible. You can see a ring shadow. Here is a ring shadow, here is a ring shadow, here is a ring shadow, and you can also see some tram lines. Here is tram line, here is tram line, here is tram line, here is tram line. Okay, this particular dog has been diagnosed with cardiomyopathy, and then the radiograph was taken. Okay, so it was found that in this particular thing you may find the bronchial pattern. Okay, instead of the most common notion, that is the alveolar pattern. So with this we finish the radiography pathology of the lung, as well as this series, the radiology series. Mostly I have renamed it to diagnostic radiology. So this has been a very wonderful journey. It has been pleasure, and also I learned a lot during the course of this period. Okay, so for making you understand these things, I have to understand that by reading. So during this also I learned many things. So thank you all very much, and I also thank Almighty. Actually I went through accident, actually fractured my rib, so it got me slightly more time. I got relaxation from my office, so I could study much, and you know that first few weeks I am posting videos because I am getting slightly more time. Now I will take some time break, then we will start the orthopedics. Okay, so till then, tata, bye bye, take care.